Well, wow, what an incredible honor. Thank you. It's wonderful to be here, and it's even better to be here because I just heard from a couple of folks that my mother, Ann Richards, was here at a former conference many years ago, so it's always wonderful to follow in her footsteps in every way. But thank you, Dr. Hafizullah, and congratulations on your year of presidency. And I told her she looked so happy because I think she's finishing her year and did a fabulous job. And Nasim, thank you for that. That was great. I know I have a creative brain in here somewhere, so maybe I can find it. It's a total honor to be here with this organization that has literally changed the faces of medicine in this country. I love that AMWA came in guns a-blazing about 100 years, I guess exactly 100 years ago. And since that time, you have trained and mentored and forwarded a generation of women doctors. And at Planned Parenthood, we benefit from that every day because now more than half of our medical directors are women, and that would have not happened without all of you. So on behalf of the 1 in 5 women in America who've been to Planned Parenthood for healthcare at some point in their lifetime, I don't know if any other alumni in the room, thank you very much for your work and for having me here today. Gloria Steinem, who's a good friend and again always puts everything right, says, women may be the only group that grows more radical with age. And you know, actually there's a good reason for that. But I think too that AMWA is no exception. You have spoken out on issues that affect women's lives in a whole variety of arenas, from work-life balance to equal pay. And just last week, I want to thank you because you threw down alongside Planned Parenthood and ACOG and other coalition partners and signed a public letter condemning the onslaught of legislators and politicians interfering in the doctor-patient relationship. And so I just want to say thank you for doing that. It's so important. It is so hard to believe with all the various problems and issues that we could be dealing with in the world that we are continuing to fight some of the same battles on reproductive rights. But as Edna St. Vincent Millay said, you know, life isn't one thing after the other. It's the same damn thing over and over again. And that's definitely how it feels at Planned Parenthood. But the truth is your work has made an enormous difference. Because over the last 100 years, having more women as doctors and as researchers and as health policymakers has transformed the care that women receive as patients. And so even though we're living through a very tough time in this country, I think in the political environment, when it comes to reproductive health care, I'm incredibly optimistic about the future because I think the next generation of medical providers, of women in medicine, is so bold and so fearless that they absolutely will not go back to the days before. So, but what I thought I'd do is maybe just put a little bit of context on sort of how we got started, because a lot of it is how you got started, and then talk about what I think are the 2 or 3 things that we got to do together. So much like AMWA, Planned Parenthood, we actually were started 99 years ago. We got our start in 1916. I'm sure some of you have heard the story when a nurse named Margaret Sanger and her sister opened the first birth control clinic in New York. And it was a tiny storefront in Brooklyn where for 10 cents, women could get a pamphlet about how to prevent unintended pregnancy. And the pictures of those days are incredible. These sepia-toned photographs with women with baby buggies and babies in their arms lined up down the block from the very first day, desperate to find out how to prevent another pregnancy. And now Margaret's goal was not only to provide information, she also wanted to get arrested. And it wasn't happening fast enough to her liking, and so she went to the press, and one newspaper headline read, "Police can't stop me," says Margaret Sanger. And so 10 days later, they did actually. An undercover woman, a cop posing as a mother, busted Margaret and threw her in jail, where she taught all of her fellow inmates about birth control, and a movement was born. And I love that sort of feisty independence because I believe that's the characteristic that we have to continue to carry on. And of course today, 99 years later, Planned Parenthood is the largest provider of reproductive health care in America. And that's pretty amazing when you think about it. Yeah, we can like at least applaud that. Despite everything they've done to shut us down, nearly 3 million folks come to us each year for everything from cancer screenings to well woman visits to birth control, and yes, for safe and legal abortion that we are proud to provide. Yep, you can hear it for that too. And as was mentioned, the other thing that's incredible is now we actually get 6 million visitors a month online, providing the same information that Margaret was providing, although I like to think it's a little bit better, 24/7 in English and in Spanish. You know, you can type in your zip code, find a Planned Parenthood health center anywhere in America. So I like to think we're like the Fandango of reproductive health care now. But it is this ability for women to plan their families and whether to have children and when to have children that has completely transformed our lives. And it's something that I think some folks have either forgotten or never knew. I mean, women are now a majority of undergraduate students in America. It's 5 times what it was before the pill became legal. Women earn half of doctorate degrees in this country, nearly half of all medical degrees, and that's coming. That time is coming. I know you're working on that. I mean, we're engineers, and we're scientists, and we're lawyers, mothers, astronauts, and by God, I believe even the United States of America is going to elect a woman president within my lifetime. Call me crazy, but I think the important thing is, as we know, is none of this happened by chance. All progress, it doesn't happen without people fighting for it. And so it's no time to let up. There's a lot left to do. And so to that end, number one goal, our pledge at Planned Parenthood is to quit talking about health disparity and fight for healthcare equity in this country. I think we've identified the problem. Now, so women are more than half the population, so it's about time we were half the research subjects and half the medical students and teachers and half the physicians in this country. It wasn't even until 1993 that when Donna Shalala became Secretary of HHS that the National Institutes of Health were required by law to include women and minorities in clinical trials. It's 1993. As Mom used to say, before Donna Shalala, even all the lab rats were white males. Right. And we got a lot of making up to do. Women and women of color experience health and disease differently. And I want to give a personal shout out to one of our national board members, Dr. Paula Johnson from Brigham and Women's, who has led the fight along with a lot of folks in AMWA, along with others, demanding that hospitals and the FDA and drug companies and medical journals all take real steps to make women's health research a priority in this country. When AMWA founded the Reproductive Health Initiative 20 years ago, you were way ahead of your time. And reproductive health education wasn't even covered in most medical schools. And you led the charge to make it mandatory part of curriculum in every U.S. medical school. And even though we're not there yet, we're a lot closer thanks to you. So give yourselves a round of applause for being on the forefront of that. So my second thing that we got to do, my second call to action is we've got to get a lot more women in positions of power at all levels of government. Because I have seen it, I'm sure you all have seen it too firsthand. Over and over, what we've seen is that for women, if we're not at the table, we're on the menu. And this is certainly happening in Congress. And yet, when we are at the table, everything changes. And this was so evident to me when we led the fight for the Affordable Care Act and leveraged what was really a once-in-a-lifetime opportunity to finally sort of level the playing field for women's health care. A radical idea, but we thought we would give it a try. And it was very evident from the very first days in Congress of fighting for the Affordable Care Act that not everybody was eager to make up for the historic inequities that women faced in healthcare. I will not tell you all the gory details of that lobbying experience, but just to give you a flavor of what we were dealing with, there was actually a hearing in the United States Senate when a senator, when they were debating whether or not insurance should have to cover maternity benefits. Yeah. And one of the male senators from Arizona, I won't name him, but you could probably figure it out, he opposed it because, quote, he said, quote, "I don't need maternity care," which would seem to be pretty obvious. But the great thing is Michigan Senator Debbie Stabenow turned right back at him and without missing a beat said, "I think your mother probably did." But we are seeing absolutely the perils of having a Congress that is unfamiliar with female anatomy. It was really evident when during this same conversation around coverage in the Affordable Care Act, one of the senators leaned over to his staff to ask, why was all the funding for cervical cancer screenings going to women? I'm not making it up. These are people sitting in Washington, D.C. Well, the good news is we actually do have 20 women now in the United States Senate, and they were trying to help educate their colleagues. Though as Senator Claire McCaskill from Missouri says, you know what would be better than 20? 50, actually. But it was remarkable, and thanks to the leadership of a lot of women and some good men in Congress, we did get historic things happen in the Affordable Care Act. And 3 things I want you to remember if you don't already know. Number 1, for the very first time, women can no longer be charged more for health insurance than men. There is no more gender rating in the United States of America, and that is unbelievable. The second is women can't be denied insurance coverage because they have had breast cancer or they've had a cesarean, things that absolutely were used to deny women health insurance coverage in the past. And third, women's preventive care is now covered 100%, no copay, and that is absolutely amazing. What we like to say at Planned Parenthood is being a woman is no longer a pre-existing condition in America. And the exciting thing about the preventive care benefit is now nearly 50 million women in this country are getting it. This means they're getting not only their annual exam, or at least they're eligible for it, their annual exam, their cancer screenings, and yes, their birth control for no cost. Now, you're right, give it up for that because that was a big fight. I mean, I can't even tell you, and obviously it continues on. I mean, we had to lobby Congress, we had to lobby the White House, we had young people dressed up in giant pill packs running around college campuses. I mean, it was insane. But now that this benefit is actually in effect, millions of women are benefiting. The numbers for the very first year of the birth control benefit, it was that women saved $483 million more in birth control that year alone, and that's only going to increase. And of course, we are seeing record lows in unintended pregnancy and teen pregnancy in America. Now that's actually progress that we can feel good about. But as we know, none of this happened without people actually standing up and being counted, which especially leaders in the medical community, and that leads to my third point, and that is with so many politicians playing doctor, it has never been more important to have doctors in the public space. It would take hours for me to enumerate all of the ridiculous examples of people who are in office who are completely mystified by women's anatomy and their reproductive organs, but they're happy to pass bills restricting them. None of you will forget probably Congressman Todd Akin from Missouri, who famously stated that women's bodies could actually just shut down a pregnancy resulting from rape. Or actually, should I say, former Congressman Todd Akin, and again, there's just so many. We could go on days, but you may have read recently in Idaho they were debating a telemedicine bill, and an Idaho legislator thought actually that if a woman swallowed a small camera for endoscopy, it could end up in her vagina. Now this is someone who's actually voting on legislation. We always at Planned Parenthood, we try to think of the benefits of some of this. So at least these are politicians that I think are making a pretty good case for medically accurate sex education in the United States of America. But in all of these issues, it has been so important to have doctors there on the front lines and physicians advocating and educating and being fierce advocates for the patients you serve, because frankly, folks listen to doctors when they won't listen to anyone else. And we experienced this firsthand in Mississippi when we were fighting a ballot initiative there, a personate initiative that would have ended all legal abortion and threatened the right to get birth control. And do you know who the most effective spokespeople were that led to the defeat of that initiative? Doctors in Mississippi, and that was not an easy thing. So if anyone here is from Mississippi, thank you. It really made the difference in defeating that bill. But from courtrooms to Congress to state legislatures, brilliant women in the medical field are speaking out. Like Dr. Jeannie Conroy, became a good friend, immediate past president of ACOG. And when she was sworn in, she declared this is the year of the woman, and ACOG has become and grown to be one of the boldest organizations advocating for reproductive health care access, speaking out in the media and in Congress and on targeted restrictions on abortion providers, and frankly just debunking the junk science that is being used to pass legislation. So thank you to ACOG and any of you who are involved in ACOG. Let's hear it for them. Dr. Lisa Harris, who some of you may know at the University of Michigan, who is pioneering innovative and important work about reducing abortion stigma among patients and among providers. And our own incoming national medical director at Planned Parenthood, Dr. Reagan McDonald Mosley, who just recently went on the MTV reality show Virgin Territory. I don't know if any of you all watched this. You don't need to, but it was important that she was on because she actually provided very much needed information about sex education to the main character on that show and her mother and millions of other people who were watching. This is the kind of work that we have to do. But the good news to me is, again, even in this very tough climate, what we're seeing is all across the country is a whole new generation of young women and men getting involved in the fight for reproductive rights. Folks who've rallied in support of reproductive health care at every turn, and at this point I have to turn to like the worst place in the country, and that's my home state of Texas. One of the toughest areas for providing care. Simply providing reproductive health care is a radical act of defiance in the state. So you may have followed that in Texas, for completely political reasons, they ended the women's health program there because they wanted to shut down Planned Parenthood. Well, actually what happened as a result is dozens of women's health centers had to close in the state of Texas that provided care to low-income women and provided thousands of women with their annual exams and with their breast cancer screenings, basic checkups. And then last legislative session, they decided to go after every remaining shred of right women had to abortion services, and they pushed through and introduced the most radical restrictions in the country. But you know what happened? The state of Texas erupted, and folks from every corner of the state got in their cars, got in their pickups, and drove into Austin to fight back. And they packed the state capitol, coming back, and they came back day after day after day, stayed till 2 or 3 in the morning, just trying to testify and get their, to have their say against these bills. I mean, women left their kids with their neighbors and their families, students left their campuses and drove to Austin. And then when my friend, State Senator Wendy Davis, took the floor for her historic 13-hour filibuster, more than 100,000 people were watching on live stream. And the Capitol of Texas, which is a magnificent building, it was packed that night. And there were lines of people all the way up the rotunda, all the way to the 3rd floor. Every single overflow room was full. The lieutenant governor called us the unruly mob. But you know, in other parts of the world, they call that democracy, actually, democracy in action. And the incredible thing about it was there were a whole generation of young people who'd never fought for these issues before. Some of them weren't even old enough to vote. One of my favorites was Bo Guidry, 9 years old. He not only watched every single hour of Wendy's filibuster from the Senate gallery, but he live tweeted the whole thing. And his best tweet was, "I thought I'd be spending my summer at Six Flags in the swimming pool. Who knew I'd be changing the world?" Now the great thing is, Bo went on and that fall ran for 3rd grade class president and won, right? So, well, I mean, the end of the story is the legislation did pass because we didn't have the votes to stop it. But even though the governor and the legislature thought that they could shut us down, I'm so proud to tell you that in December, I was back in Dallas to cut the ribbon on a brand new Planned Parenthood health center that provides safe and legal abortion to women all across the state of Texas. And we're about to do the same in San Antonio this spring. So it's time not to get discouraged. It's just time to double down, right? And get busy. As my friend, Congressman John Lewis would say, it's time to get into necessary trouble. The last 100 years have seen a transformation in women's health care in this country, and it's my belief that the next 100 years is going to bring even more. But if we've learned anything over this last century, it's that progress isn't inevitable and change doesn't happen on its own. It happens because a group of fierce and fearless women become doctors before the AMA would accept them. So they form their own medical society because they know it's their obligation to not only walk through the door of opportunity, but to hold it open for everyone else who comes behind them. And it happens because women at the highest level of policy making in this country demand funding for women's health care and research and begin to get it. And it happens because doctors bravely testify in court and before Congress, and they sign letters and lend a much needed medical perspective to the national conversation about reproductive health care. But it also happens just because doctors do what they do. Like one I met in Des Moines, Iowa last year at a Planned Parenthood Health Center. I was there that morning and before they opened, and she admitted that while setting up the procedure room, she was really worn out, and she'd been thinking about giving up the job, just giving into the exhaustion and getting something that was easier to do. But then she told me, but you know, when our patients are here, they need us. And they need us as much as anybody has ever needed another person in their life. And how could I walk out on that? And so she didn't, and she's still there, and she's right. Planned Parenthood and the American Medical Women's Association may be 100 years old, but you're our second century inspiration. I think the future is yours to build, and it couldn't be in better hands. So thank you for your courage and your leadership, and thank you for what you do. It's great to be with you. Thanks a lot.